Is This Normal, Doc? A podcast sponsored by Tanner Clinic. Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal healthcare provider.
Welcome back to another episode of Is This Normal, Doc? The podcast where we talk about what's normal and what's not with the expertise of our Tanner Clinic providers. I'm Hope, and I am your host. Today, joining me as my co-host is Tara, my boss. And our guest for today's episode is Dr. Bryan Richards. He is an ear, nose, and throat doctor at Tanner Clinic, and I am going to give him the opportunity to tell us a little bit about himself and how he got into this field.
Well, I'm a native of Utah. Went to the University of Utah for 8 years. They trained me how to be a medical doctor. Then I went to Connecticut to become an ear, nose, and throat doctor.
Oh, fun.
I've been here ever since.
Yeah.
Digging out earwax on a daily basis.
I'm so glad you chose to do that, because somebody has to.
Somebody has to take the earwax out, and that's, I think, the reason I was born, actually.
Really?
Mm-hmm.
Is your calling?
It's my calling in life.
Everyone
to
has
take
a
out
calling,
earwax.
And sometimes it's earwax.
Somebody's got to do it.
I'm so glad.
I'm glad we could talk about that today. People have a lot of questions about earwax.
I do. I know I do.
I know.
And so I'm going to ask them.
Okay, let's go.
Okay, we got a few questions today that have been submitted either online or, honestly, some of them are personal questions. I'm not going to lie. I added some of my own in there. If you want to be updated on the future episodes of the podcast, be sure to follow us on our social media. We do put prompts out on there. You can ask your questions to our future guests. So let's get started. Why do some people have more earwax than others?
That is a great question.
Thank you.
Earwax is a skin product. It's made by the skin. And so if you think about, some people have oilier skin and some people have drier skin. Maybe they have more acne, less acne. So it's a product of how almost the oil glands in your skin and how productive they are. The wax glands tend to be productive in people who are have productive oil glands. So some people just make more. It doesn't mean much. There is a little bit of difference based on your skin type and ethnicity, but anybody can make a lot of wax if they're skilled at it.
So how much is too much earwax?
Too much earwax is defined only by when it blocks your ear so you can't hear anymore. So
that has happened to me.
Or if it's hanging out and somebody notices it and thinks, oh, that doesn't look very attractive, that you have a big ball of earwax that's about to fall out of your ear. That's what people are afraid of. So then they grab for the Q-tips. And the ear, nose, and throat doctors always cringe every time they grab for the Q-tips because we know there's nothing but trouble with those Q-tips.
I love them.
So what do you use instead of the Q-tip then?
You can wash the outside of your ear with a Q-tip, but you're not really supposed to go down in the ear canal with that Q-tip because it can push the earwax down against the eardrum. It can actually cause irritation of the skin over time if you do it every day. But some people almost get addicted to it. It's like they just can't get out of the shower and not put a Q-tip in their ear to dry their ears.
Because there's stuff in there. There's water.
There's water in there. There is.
I usually just go around the outside.
Okay.
But sometimes I do go a little bit.
I know.
Inner.
Sometimes I can tell when I look in someone's ear and the shape of their earwax is just the same as the shape of the Q-tip.
Whoops. I know people have different colors of earwax.
Yes.
Is there a meaning to that? Is there some that you should be concerned about if your earwax is a certain color?
No. See, most people will have kind of a golden brown earwax, or it'll be brown. It'll go from golden brown all the way to almost straight black. And that doesn't really mean much at all.
Oh, good.
And when you have an infection in the ear canal, you'll get a different color of wax that can be significant. So actually, pale white wax is worse than dark brown or black. That doesn't mean anything bad.
Interesting.
There you go. I would think it would be the opposite. And I feel like probably most people do think
you
it's
might
the
would think
opposite.
it'd be the opposite, but we have more trouble with the light colored stuff when your ears are really itchy or they're draining. So
Okay.
So, no Q-tips in the inside of your ear.
don't stick them down in.
I use Q-tips around the outside of my ear.
Right.
What if I really feel like I need to get something out of my ear? is there another method that's safe for me to use?
You could take a tissue, stick it right up against your ear, and then tip your head to the side and try and get the water to drain out to it. Or if you don't have a hole in your eardrum, you can use drying drops. There's over-the-counter products that are ear drying drops, and they're alcohol-based. And if you put those in, they'll dry the water out of your ears really quickly. But if you have a hole in your eardrum, it's going to be the worst day of your life.
How do you know if you have a hole in your
You're
eardrum?
going to have a doctor look at your eardrum and make sure you don't have a hole.
So if I put it in and I do have a hole,
It's going to burn so bad.
okay.
It's going to hurt.
It's like a quick diagnosis right there.
That's one way to find out if you have a hole in your eardrum is to pour alcohol-based drops in your ears.
Yep. Then go see you.
If it hurts, come see me.
All right, so I've seen videos on social media of people using those ear candles.
Yes.
Does it even work? And two, is that a safe thing to do?
Well, I've never tried one myself, but I know they don't work because I've seen people come in and they're designed to create a negative pressure or vacuum to suck earwax out, but that just doesn't work. So they're a no-go. There's also some over-the-counter products like almost shaped like a corkscrew that you put in your ear and try and get the wax out. And I don't know that those work either. Now, I do have a solution for people who really are curious about our earwax, and that is to get what's called a digital otoscope. It's about the size of a cell phone, and it's got a little wire that comes out.
I've seen those.
And you can stick the wire in your ear and see what's going on in there.
Yeah.
And if you see some earwax, I don't want you to get too excited or worried because there's supposed to be some in there.
Yeah.
But if all you see is nothing but gobs and gobs of earwax, maybe you need to have that taken care of.
Yeah.
So make an
But so
appointment.
don't try and get it out yourself, but just look in there to see if there is earwax.
Look in there to see if there is earwax. Now, the devices will often come with a little scoop that you can attach. And if you're very skilled, you could maybe get it out yourself safely. But that requires some eye-hand coordination that is pretty amazing. But
So someone like me with a hand trimmer probably wouldn't.
with
be
a
good.
hand trimmer, you'd just be poking a hole in your eardrum.
Okay.
Stop doing it.
I won't do that. But those look really cool. I've seen
Those
people
are,
post
those are the best resource out there because you can really see what's going on instead of guessing. And people are probably putting ear candles in their ears and they don't have any earwax to begin with, and they're treating their earwax, and the ear candle makes it look like something came out and they feel like they did something great and it was completely worthless from the beginning. But if you have a camera where you can actually see what's going on, then that's useful.
Sometimes your ear feels clogged, like you can't hear.
Right.
Does that necessarily mean that I have an over buildup of earwax, or could that be something else as well?
That can be many things. It can be hearing loss, it can be fluid in the ear. Sometimes even if your jaw joint's inflamed, it'll make your ear feel like it's full when there's nothing in there.
I feel like that happens to me
So
sometimes.
yeah, one of the most common things in young females in particular is jaw joint irritation, and TMJ mimics a pressure in your ear, and you feel like, oh, there's something in there. And you come to the doctor, how's my earwax? And there's nothing in there. It looks fine.
I actually have gone to the doctor before because I thought something was in
Yeah.
my ear, and they were like, it's fine.
Yeah.
I was like,
Or if you've had a
not
bad cold and then you get fluid in your ear after a cold, that's a very common situation.
yeah.
So, but we're always happy to check and see. The older folks, sometimes they'll come in and say, will you clear the wax out of my ears? And I look and there's no wax. And the reason there's no wax is because their hearing's gotten worse and they want it to be earwax. So there's a solution, but oftentimes that's just the advancement of their hearing loss.
When in doubt, I would say, though, go get seen.
Go get seen,
just
get
in
a hearing
case.
test. That's
Yeah.
the best way to do it. Hearing tests are easy enough to do and can make a huge difference on diagnosing what the actual problem is.
Yeah.
So we had another question on social media for you about hard wax buildup. How do you prevent that? Or is that just like a more genetic thing?
That is individual dependent. It has to do with their skin and their skin type. And there's nothing really significant about it other than that hard wax will sometimes be more painful if it gets stuck in there or lodged in. It can be the more painful earwax, especially if you leave it in there too long. Some of those wax balls will be almost as hard as a little rock, and getting those out can be tender.
Okay, so when you're swimming and you feel like it's clogged, right?
Yeah.
One of the solutions that it always worked for me, but I actually don't know if it's safe, so I'm going to ask you right now. So we use those medicine dropper things that you
Okay.
push, and you just push warm water and push it into the ear, and then you let it come out and keep doing it until it unclogs. Should I keep doing that? Because that's what I do with me and my kids.
Oh, really? Well, that actually can be useful.
Okay.
Or you could take the blue bulb syringe that you suck out a baby's nose with, fill it with warm water, and rinse out your ear.
Yeah.
You can do that safely. If that doesn't work, though, you might need some help. But that's okay to do, actually.
Okay. Yeah, it just adds a little more pressure.
You need a
The
little
water goes
pressure
in.
to get the
Yeah.
water in. Sometimes that'll push the
Yeah.
wax out.
It does work.
It does work.
I just didn't know if it was safe, so I'm glad to know that I'm not
It's
blowing up
safe
my
as
kids.
long as you don't jam that glass pipe into your kid's ear.
Yeah, well, it's plastic. It's fine.
Oh, it's plastic. Okay.
Well, it's just like the syringes you give them, like their Tylenol and the
Oh, yeah.
the little those things.
Oh, yeah, those.
You just
Those
fill
are.
them up with water and then you
Yeah, okay.
whatever those are called.
Yeah, those are syringes.
Yeah,
I've
syringes.
never heard of doing that.
Yeah, it works really, really good. But warm water, because I also heard that if you do cold, it can make someone nauseous.
Either if it's too warm, it can make you sick to your stomach, or if it's too cold, it can make you sick to your stomach.
Okay.
So you want it to be about body temperature, so about 96 degrees. So whatever feels is comfortable temperature-wise is the right temperature to use. You can also use peroxide with that. Peroxide will work, or half peroxide and half water is fine to do.
Yeah. I would worry that it would get, so this is my other tip. If you end up doing this, you get towels to prevent it from getting in their eyes because kids always cry. But if you're using peroxide, I don't know, that might get a little tricky.
Yeah.
Because when it squirts, just so you know, it kind of comes out a lot. So I usually put
It's
a
a
towel
mess.
around my kid, around their whole body, and then we put another towel so they can just kind of, but it works.
Okay.
There you go.
There you go. There's
That
the
was my
Terra
tip
tip.
of the there.
Terra
well,
tip's better than Dr.
It came from my
Richards'
brother who's an NP, so I can't say that it was my tip. I know. All right. So next question: can earwax cause ear infections?
Earwax usually does not cause ear infections. Now, if you have your ear as 90 to 100% blocked with wax, and then you get water in, and then you can't get the water out, when that water gets blocked or trapped inside the ear canal because of the wax, then it does cause an outer ear infection. Mm-hmm. Those can be very painful, and often will require eardrops or antibiotics to clear up. But the main thing is to get that big clump of wax out so you can get the fluid out of the ear canal. So rarely does that happen, but that is one time when an earwax problem can cause an infection that can be painful. Yes.
So because I have children and they get ear infections, what's something that can help with the pain when they do have an ear infection?
We used to have numbing drops that you would put down in the ear canal. It would numb the eardrum up, but we don't use those as much anymore. You can use cool water or warm water just to put in there to soothe it, but that's really not going to do anything more than Tylenol or ibuprofen. That's usually the best thing
Just
to use.
rotate those.
Yeah, that's usually the best.
Maybe we were on an airplane once coming from Florida and my daughter had a double ear infection and maybe we didn't know till we got on the airplane and maybe she screamed for 4.5 hours. It was amazing.
Ow, yeah, that's
it
bad.
was rough. We gave her Tylenol, but there was really nothing we could do. It was pretty rough.
Yeah, that's
So
really,
good to know that there
really
wasn't
hard.
anything else I could do because everyone on the plane hated me.
Yeah. I love having the one screaming kid on the airplane.
Never had it for 4 hours straight. The stewardess was seriously like, do something. I'm like, I don't know what you want me to do. She won't
You
stop
should have
screaming.
told the pilot just to drop down to 8,000 feet, and my kid's ears will feel a whole lot better.
Yeah. Oh, it was definitely, she was in a lot of pain and so was everyone around her.
Yeah.
So, yeah.
We could talk about equalizing your ears when you fly. That's a very common question
Yeah.
for people.
I would love to hear
Yes.
tips about that, actually.
When you fly in an airplane, the airplane goes up with a pressurized cabin. Then when it gets to above about 16,000 feet, the pressure in the cabin goes down. So from 16,000 feet to altitude, which is about 32,000 feet for most flights, your ears are going to be able to equalize fine. But when you start to come down from altitude to 16,000 feet before the cabin is completely pressurized, you have to equalize your pressure in your ears. And if you can't do that, then you're going to have ear pain, pressure, sometimes even blood will form in the middle ear space from that. So it can be very painful, and that's what makes kids scream. So if they have a cold, and then when you start to descend, then you have trouble. So it's a good idea if you have children to have them be chewing gum or working on a lollipop as they're descending for that. It's usually only about 30 minutes that takes the plane to get from 30,000 feet to 16,000 feet. That's the key time. And if you keep popping your ears during that time period, or pinch your nose and blow, or move your jaw around, or whatever you have to do to get those ears to pop, that's the time when you need to do it in the plane.
That's good to know because we always do gum as soon as we were starting our descend, and I'm glad that
descend is the time you need to do it.
Yep, or snacks. If they don't want gum, then give them goldfish or something, but we always make them
Of course, you had that one experience with 4 hours with your child.
But it was a double ear infection. There's nothing
She said never again.
Never.
Never again.
It was rough. It was really rough. And my husband was on a different flight because, anyway, so I got to do it all by myself. It was super fun.
As I get older, I've always had motion sickness, dizziness, things like that. It's gotten quite a bit worse as I've gotten older. Does that have anything to do with earwax or anything being like in my ears? Or is that something that you see people dealing with a lot?
That's a very common thing. The human balance system matures as you get older. And when you're 3 years old, it's really fun to swing around in a circle. And when you're 40 years old, it's not so much fun anymore.
I can barely get in a car these days.
Yeah. So everybody's balance system just gets more resistant to a lot of movement as you get older. And that's really unrelated to earwax. And for the most part, it's unrelated to ear infections. It's more of an inner ear problem that is part of the way our nervous system develops over time and changes over time. So
is there anything you can do? Because I loved roller coasters, loved all of those rides, and now I get so sick. And I really want to go on these things, but I get sick. So is there anything that I can do to prevent that?
You can try and take medicine before, like Dramamine or...
That's like my golden...
Yeah, Dramamine before you go. But once you've overstimulated yourself and you get sick to your stomach, you're done for the rest of the day.
Yeah.
You're not going to be able to overcome it. So you can try and take stuff to suppress it, to pretend that you're young, or you can just accept how old you are.
I'm not going to ever do that. Never grow up, never surrender. Also, what about the wrist things? You know, the pressure points?
Yes.
I wear those when I go on a cruise because I get motion sick.
Yes.
Does that also help with rides, or is that there's no go for me?
You know, in Western medicine, they don't tell you about the connection between the wrist and the balance system. Maybe the Chinese doctors are smarter than we are, but I can't figure out how that's going to help.
Okay.
Is it a placebo?
Well, placebos are a real thing. 30% of people get better with placebo. So if it works for you, do it. You know?
I'm willing to try anything.
I will wear those wristbands
so I can get in a car and drive without feeling
wear your
motion
wristbands.
sick. I have to be in the front seat or driving.
The secret is to be looking at the horizon, and that's sort of true if you're on a cruise to any situation where there's movement. If you can be focusing on the horizon, your brain makes more sense of the motion if at least one point your eyes are stable. So
I went on it was like an hour-long plane ride recently, and I got so sick. I took Dramamine.
Was this a small airplane, like a little Cessna or something?
No, it was regular.
A regular commercial plane.
Yeah, a regular commercial plane. And my mom told me, she said, just focus on like a landmark. So I would focus on like one cloud in the distance, or I would focus on like one mountain peak or something. And that did help me quite a bit. I just had to like focus on one thing. I was like, I'm not going to make it through. I can't do that. I don't know. It's horrible.
Hard. No, it's one of those things that happens to all of us to some degree.
Yeah.
So you have to pre-medicate in that situation. You have to take something before, because once you get sick, it's hard to reverse that wave of nausea and kind of seasickness feeling that you get.
I just pelt myself with the cool air and get ginger ale and pray for the best.
That's why they have ginger ale on airplanes. I didn't know.
It was really spicy the last time, though. I don't remember ginger ale being that spicy.
There are ginger chews you can get, too, that can be
helpful.
They're a lot stronger than the ginger ale, but they can be helpful as well.
Tips for flying.
Tips for flying.
And for cruises.
For cruises.
Never been on a cruise? There's a reason for that.
Well, so just really quickly, a funny story. I knew I was going to get sick, so I took a Dramamine. And then the people on the cruise ship, when I started getting sick, also gave me a patch. Just so you know, if you do Dramamine plus a patch, you may just be roofied yourself, because I was out like for the whole day.
Yeah.
Completely out. So be careful to not maybe over-medicate yourself.
Dramamine can really sedate some people. So if you're not sure, you might want to take a half a pill instead of a whole one.
And there's another one that's supposed to be non-drowsy. What is that one called?
Meclizine or something?
Bromine, or I don't know.
Oh, bromine, maybe.
Is that what it is?
Yeah.
Yeah, it's supposed to be not as drowsy, because the patch plus that, I was gone.
You were gone, yeah.
My husband left me on a couch while they went to a comedy show.
Did he ever tell you whether he had a good day that day, or?
I know, right?
You're really throwing him under the bus in this episode, so you better
never
hope that he never watches
if you know
it.
Him,
that was his favorite day on the cruise for some reason.
Left me on a couch and then dragged me back to the room. It probably looked really bad, but anyway. All right, so another question. A lot of people wear their earbuds. Some people also have hearing aids. Do those cause more earwax buildup? Is there something we need to know about using our earbuds too much? Because maybe I fall asleep every night to a podcast with the earbud in my ear.
People worry about their earbuds, but they usually don't cause too much trouble. I wouldn't sleep with them in, but if you're having trouble with your earbuds, you'll feel it. I mean, it's usually at the contact point where the earbud hits the ear canal. So if you're not having too much trouble with that spot, you're probably fine. I don't worry about the earbuds too much.
I was told I have small ear canals.
Yes.
And I produce a lot of earwax.
Yes.
So I can never find earbuds that fit into my ears.
Yes.
I feel like.
Yeah.
But is that, I guess I was just asking if that's a real thing.
Yeah, that's a real thing. Some people have smaller ear canals, or the shape of their ear canal is not round. I mean, those earbuds are designed for people with a round ear canal. A lot of people have an oval-shaped ear canal, and so they don't fit very well. So it can be hard. I mean, you can get custom-fit ear molds. That would be one thing you could consider.
How expensive is that, though?
They're only about $30 to $50.
Oh, that's not bad.
I was expecting way worse.
Yeah, so some custom fit molds can be helpful for that situation.
So this podcast is called Is This Normal, Doc?
Yes.
And I'm curious to know if you have any interesting, not so normal instances that you have witnessed in your time practicing.
Well, I can't forget this one gentleman from my residency. Now, I was back in Connecticut, and so that has to be taken into consideration. The man was a bald man, and he was out raking leaves under a tree. What he didn't realize is that there was a raccoon in the tree above his head. And the raccoon fell out of the tree and landed right on the top of his bald head, and then began to run as fast as he could. Well, raccoon's claws on the top of a head created all these lacerations on this poor man's head. So my job as the junior resident was to sew up all of the scratches on the top of his head. While we were having this conversation, he told me that about a week prior, he was sitting there with his wife watching TV, and he heard a buzzing noise that flew into his ear.
I know where this is going.
Waiting for it.
And he said it buzzed for a while, and then the buzzing stopped. And so I thought, well, once I'm done sewing up this guy's head, I should really check his ear. And sure enough, he had a fly in there that had been in there for a week. And I thought,
Did it
Was
lay
it
eggs?
big?
Did it lay eggs?
it didn't lay eggs. It wasn't really big. But what are the chances that you have a raccoon land on your head and have a fly in your ear at the same time?
The man has bad luck.
That guy does not have good luck.
I feel like we have to ask, because I mean, you go online and you always see. I'm so weird. I love watching like earwax removal videos.
Yeah.
It's so satisfying when they get like a bunch out of there. But there's instances where there's bugs. There's
Yes.
like spiders. I saw one that was like
Yeah.
just a full on big old
earwigs.
bug. And
Do earwigs actually go in your ear?
how common is that?
Yeah.
Like, do we need to be worried?
Well, there was actually a study that cockroaches were the most common thing to go into the ear, but that was out of San Diego. So I think you turn the lights on and they want a deep dark hole, and the ear canal is a deep dark hole.
Hair
But-
over ears.
Tape.
I haven't
Headphones.
seen a lot of cockroaches, but every once in a while you'll get a little insect or fly or a gnat or something in there like that. Yeah, not pleasant.
Have you seen, though, the eggs thing? I keep going back to that, but I really want to know.
No.
Is there any
I
insects that have ever laid eggs?
I haven't
in
ever
something?
seen eggs in an ear
Have you
canal.
ever heard about it? Is that a real thing?
Oh, wait, I guess I have a story from Haiti about eggs. I went to Haiti after the earthquake in 2011, and there were a lot of wounds on people's faces, and there was a 4-year-old boy who'd been hit and had lacerations on his ears, and flies had landed on his ear, and there were maggots in his ear and
baby.
around the base of his ear that I was trying to clean out. So
Baby. What do you do to do that?
So apparently maggots can be, you starve them of oxygen. So if you cover them with plastic or cover them with water, then they will try to come out. So we had to do that to try but I had to surgically remove the maggots from his ear. That was pretty sad, but that's not likely to happen.
But that's like an extreme case.
That's a very extreme
Yeah.
case, maggots in the ear. I would say that's a very extreme case.
Yeah.
But the thing about earwigs, I looked this up because I was curious about earwigs. They have these little pinchers, right?
Yeah.
And there was this concern in Great Britain 200 or 300 years ago that the earwigs would go in and with their little pinchers go right through your eardrum. So that's how they got the name earwigs, but they don't really do it. But they can fit in your ear canal just fine. In fact, we should try that sometime, get some dead earwigs, and we'll put them in your ear canal, and then we'll take some pictures, and we'll see if we
You
can get some
couldn't
social media.
pay me enough.
to put an earwig, dead earwig in your ear.
Yeah, I think I'm fine.
What about a potato bug?
No. I'm
Just
not putting
sounds
any-
tickly to me.
Yeah.
But you can always drown them. Pour some alcohol and peroxide in there, and it'll kill them. But that doesn't remove the insect.
It doesn't
in your-
remove
But
it.
if you go like this, and then you just flip them out, maybe.
Yeah, if you.
Yeah, totally. They just
I would
fly
do
out.
anything at that
Yes,
point.
I'm
I'm
sure.
not going to wait to make an appointment.
I know. The
I'm just gonna
idea
freak
of having
out.
an insect in your ear is just horrifying.
I would do my water squirter thing.
Yeah, you could try that. Might work.
It might get pieces out at least.
Last question that I have for you is, what is the biggest misconception that you hear from patients that come in to see you?
Specifically when it comes to the ears, I think the biggest thing is that they feel like if they have wax in their ears, that's a hygiene problem, that I'm going to look down on them because they don't clean their ears like they're supposed to. When I look in the ear canal, I expect to see a little bit of earwax in there. If I see a little earwax, that says healthy ear canal. Earwax is antibacterial. It can help keep water from getting up against the eardrum. You're supposed to have it down there. It's not supposed to be hanging out where people can see it. But in the ear canal, that's a normal thing. So you shouldn't clean your ears. You know, people kind of like feel like they have to brush their teeth twice a day. You don't have to clean your ears once a day. It's better for your ear health if you leave them alone.
Did you hear that, Hope? Did you hear that?
Can you
I
do
am
it?
one of those people that
Can
is
you
like,
do
it's
it?
a hygiene thing. I'm
Right.
like, I just need to clean.
Yeah,
but
no,
I'll
you don't want to
stop.
clean. Yeah, you got to stop. You got to stop.
I'll try.
Okay.
I just like clean ears. That's all I got to
It's
say.
not a hygiene thing to have wax in your ears. It's normal.
Okay.
It's supposed to be there.
Thank you for joining us today.
Well, that was so much fun. I learned a lot more about you two that I didn't know.
And we learned a lot more about earwax, which I was really excited to learn about because apparently I produce a lot of it and I have small ear canals.
It's an amazing substance.
But I will stop using Q-tips.
Okay.
At least
the inside.
I'm going to still use them on the outside.
That's fine.
I'm
Use
sorry
it-
to say.
Use them on the outside. Just don't
Yeah.
go down in.
But I learned some useful tips.
Yeah, hopefully.
Those eardrop things.
Yeah.
I might try that.
Yeah.
I might learn that I have a hole in my eardrum, but at
Then
least
you
I
can
know.
make an appointment.
You'll know.
Yeah,
one
and
way
then
or
I'll
another.
make an appointment.
Easiest way to find out.
If I have a wax buildup in my ear, I've only ever had my family practice doctor get it out.
Yes.
Is that fine? Or is it better to make an appointment with someone who's more specialized in that area?
That's a good question. There's a couple different techniques. The ear, nose, and throat doctors, we have a microscope and some microscopic techniques, so we tend to pick the wax out
Yeah.
rather than always irrigate it out with warm water or salt water.
Yeah.
So some people really don't like that wet feeling that you
It's
get
not my favorite.
when they spray that in there to clean the wax out. So if that's not your favorite, then go to an ear, nose, and throat doc and we'll get the wax out for you.
Yeah.
It's usually easy to do under the microscope. We got all the magic tools for that.
Perfect.
There is a slight association between itchy ears and itchy anus. I don't know if you knew that.
Really?
Yes.
I did not. Tara? That might be a helpful tip for
Right?
you.
I think I need to make another brochure.
Yes.
Yeah.
That's why you have two hands so you can scratch one at a time.
Gross. I'm just kidding. And then wash your hands
And then wash your hands
5 times.
and switch.
And switch.
Yeah. No. I thank you for that.
Yes.
For that final tip.
I
It's
just
really
wanted
nice
that
to have you
last
on
thing.
here and bring that little bit of knowledge
It-
to our lives.
It's important.
Yeah.
Well, I'm just trying to save the world from earwax, so anything I can do.
So if you have any issues with earwax or any ear, nose, and throat related problems, make an appointment with Dr. Richards. He's amazing.
And once again, if you want to follow along with our journey, please follow us on our social media. We post questions frequently on there for our upcoming episodes. So if you want to get your questions answered, please follow along. We would love to answer those for you. And we'll see you on the next episode of Is This Normal, Doc?